Hello, I'm Avril Flynn. I'm a midwife and a mum of one, so I know how difficult it is when your baby isn't feeling well. The first thing to say is, remember, you are your baby's expert. So if you are worried or concerned at all, then it's best to seek the advice of a GP. But it's great to know some little tips to be able to care for your baby when they're not feeling well. So the first thing to say is that it's normal for babies to get coughs and colds in the first year of life. While it's not really pleasant, it's a normal way that their immune system grows. These coughs and colds are caused by viruses, so antibiotics are not going to work. So there are a couple of other things you can do to help make things a little bit easier for them and of course for yourself. Babies don't actually learn how to blow their nose until they're about 2, so you need a way to actually clear that congestion from their nose. And a really good way to do that is either by using saline drops, or what I find brilliant is saline spray. Saline is just literally salty water, and what it's doing is it's going to loosen the mucus and then allow you to use something like a bulb syringe to actually get it out to clear their nose and make it easier for them to breathe. So I'll just demonstrate that now. So this just literally has a little bit of a spray that you put up the nose. So you're going to hold your baby. Sometimes they don't really like this, but remember, the more you do it, the better you'll get at it, so the easier it'll be for you and your baby. So you're going to place one finger over the nose and spray it up the other nose. Then you're going to get your bulb syringe, squeeze it at the bottom, place it to the nostril, and then let it go, and that's actually going to extract the mucus and any spare saline. Then you're going to give this a good wash out and use it on the other side, and hopefully then your baby will be able to breathe a little bit easier. A very important tip is to know how to effectively take your baby's temperature. So if you are worried about their temperature, while holding them, you can feel that they're a little bit warm, it's better to be able to actually know how to use a thermometer. There's lots of different types of thermometers. Some you can use on their forehead, some rectally, but I actually find one of the easiest and best ways to become proficient at it is to be able to take it underneath their arm. So just an ordinary digital thermometer, of course, remember to turn it on. You're going to pop it underneath their arm. Remember, skin on skin, so this baby's wearing a baby grow, but we'd have that baby grow off, and we'd hold that down. It would take between 15 to 20 seconds for most to give you a reading, and then it'll have that little beep. A normal body temperature for a baby is anything from between about 36.4 up to about 37.4. Anything above or below that is concerning, and you should always get that checked out. An easy way to treat this is by using something like a liquid paracetamol, something like Calpol. So Calpol's in a liquid form, and you would just give that into the baby's mouth. Always follow the manufacturer's instructions, so never exceed the dose. If they're a little bit older, so above 3 months, you can give an ibuprofen, a liquid ibuprofen, and there's also other forms as well. This should bring the temperature down. If it hasn't brought the temperature down, that would be another reason for you to seek medical attention. As well as that, always remember room temperature. If a baby is a high temperature, make sure you don't have the heating on full blast. Also make sure the baby's stripped down to their vest. Remove any hats or heavy clothing. Also make sure that you're talking and comforting them. Another top tip is to make sure that when your baby isn't feeling well, that they're very well hydrated. By that I mean that you're going to be offering the breast or lots of extra feeds, just to make sure that they've got lots of fluids in their system. If you're worried that they're dehydrated, so by that they're not taking many fluids at all, or that their nappies are dry, again, that's a reason to go and see your doctor. I hope some of those tips will make it a little bit easier on you and your little one, but again, as I said at the beginning, you are your baby's expert. If you're worried or concerned about anything, never be afraid to go to your GP or ask another medical professional for their opinion. I hope you have a lovely day, and I hope that your babies feel very well soon.